and blindness. That is because of glycosylation as well as atherosclerotic changes that occurs into the blood vessel. Now, as there is a no glucose for utilization for the calories, there is an increased utilization of fat and proteins in absence of insulin. So there will be weight loss as fat and proteins are utilized. Second, glucose is not utilized, so patient will have a complaint of weight loss, sudden weight loss. There will be weakness as glucose is lost, patient is not getting enough calories as well as fatigue. That is called asthenia. And as glucose does not, patient will continue feeling hungry. So will continue to eat. That is called polyphagia. So these are the these are the symptoms of diabetes mellitus because of increased utilization of fat and proteins and not utilization of the glucose. Now, increased fatty acid utilization that leads to excessive production of keto acids. So that will lead to ketosis and metabolic acidosis. So in this case, there will be cellular dehydration as ketone bodies are present into the extracellular fluid, that is the blood. Now ketone bodies are acids. So they will dissociate and release the hydrogen ion. This hydrogen ion is buffered by bicarbonate and ultimately will form a carbonic acid. This is a buffering effect. But the side effect is that there will be excessive utilization of bicarbonates and that will lead to fall in bicarbonates in the blood. Ultimately, it will lead to acidosis. Now, as it is because of ketone bodies, it is called ketoacidosis. Acidosis because of ketone bodies. And that will ultimately lead to diabetic ketoacidosis leading to coma and death because that leads to even cellular dehydration of brain cells. And compensatory mechanism, if we say the symptoms will be rapid deep breathing, that is it is a compensatory mechanism that rapid and deep breathing will that will lead to increased expiration of carbon dioxide. That is the one of the sign of acidosis, rapid deep breathing. Because of acidosis, there will be increased production of carbon dioxide, and that will be the increased respiration to expel it out from the body. So it is a compensatory mechanism, but it is an important sign to diagnose diabetic ketoacidosis. Coming to the type 2 diabetes, that is more common. 90% of the cases, all cases in a population is suffering from type 2 diabetes. It occurs after age of 30 years and oftenly seen between 50 to 60 years of age. And it is also called adult onset diabetes mellitus because it is seen after the age of 30 years. Now in this, obesity is mainly a predisposing factor. Now here the problem is different. Insulin is synthesized, insulin is released, but insulin is unable to have a action on tissues. So what will happen? A compensatory mechanism will lead to more and more insulin secretion because the tissue will feel that there is a no insulin, right? But actually tissues are insensitive. They are resistant to the action of insulin, finding and sensing that there is a no insulin. So compensatory mechanism will happen and that will lead to more and more insulin production as well as more and more release. This is called insulin resistance. Now that leads to impaired glucose utilization and increased blood glucose level. In a simple way, to understand that there is a insulin, but it is not effective. Now, obesity and diabetes. Why diabetes is more common in obesity? Now, in obesity, the fewer insulin receptors are present in muscle, liver, and adipose tissue. That is commonly seen in a obese patient compared to the lean person. Means insulin receptors are very less in obese person compared to the lean person, right? And the second reason maybe there may be abnormalities in signaling pathways, as we have seen adenylyl cyclase functioning and enzyme activation. So these are the signaling pathways may be abnormal because of toxic effects of lipid that is accumulated secondary to the excess weight gain. So whenever there is obesity, there is more lipid in cells, and that will produce abnormalities in signaling pathways of the action of insulin. So these are the two main reasons that is why diabetes mellitus is more common in obesity. Now, genetic feature is also sometimes seen that if parents are having diabetes, because of genetic reason, children develop um diabetes mellitus, and that may be because of there is a genetic reasons that impair the insulin signaling. PCOS, now females having PCOS, that is polycystic ovarian syndrome, in them they are sometimes linked with development of diabetes. There may be the reason there will be insulin resistance is routinely found in PCOS. Another, that is a Cushing syndrome, in which glucocorticoids are there. So in that the person suffers from diabetes mellitus. But we have seen that glucocorticoids as well as acromegaly, that is the excess growth hormone. Now the function of glucocorticoids and growth hormones, they both stimulate the insulin secretion. Now if this condition continue for the longer time, it will lead to exhaustion of the beta cells. Beta cell gets exhausted in secreting insulin. So ultimately, it will lead to insulin deficiency. And this is the reason that the Cushing syndrome and acromegaly, the person, the patients are now, due to insulin resistance, in spite of increased level of insulin, hyperglycemia occurs after ingestion of carbohydrate in a early stage. तो early stage में इंसुलिन होता है, उसके बाद भी हाइपरग्लाइसेमिया होता है बिकॉज टिश्यू रिस्पॉन्ड नहीं करती इंसुलिन को, तो दैट विल लीड टू hyperglycemia. But in the later stage, now beta cells exhaust and do not produce insulin, and full-fledged symptoms of diabetes will develop. Now, how to diagnose diabetes mellitus? Now, these are the diagnostic tests for diabetes. First one is the urine sugar. So, glycosuria, that is the presence of glucose in urine, is a diagnostic test for diabetes mellitus. Secondly, we can go for plasma insulin level, that is the serum insulin level. So we have to find out how much insulin level is in that in the blood. In type 1, there will be very low or even undetectable during fasting as well as after meal. Because type 1, the reason for type 1 diabetes mellitus is the synthesis and secretion of insulin is not there. So insulin level in a blood will be very low or even undetectable. Whereas type 2 diabetes mellitus, the reason for it is resistance to the insulin. So insulin होता है लेकिन काम नहीं करता. So in type 2, you will find very high level of insulin that usually increases after meal. So this is the differentiating point between diagnosing type 1 and type 2 diabetes mellitus. In type 1, there will be low or absent insulin in the blood. In type 2, there will be very high level of insulin. The third test is a fasting blood sugar. So person has to remain on fast from 10 p.m. Of the previous day, and early morning the blood is taken for the testing of sugar, blood sugar level. So normal it should be 80 to 90 milligram per deciliter, and if it is 110 milligram, then it is called upper border of the normal limit. If it comes more than 110 milligram, then it is considered to be borderline diabetes mellitus. The fourth is a GTT, that is glucose tolerance test. In this, the patient is kept on a fasting. Then in the early morning fasting, blood sugar is tested, means blood is tapped. Then ingestion of 1 gram of glucose per kg of the person's body weight, that much amount of glucose is given. If person is weighing 60 kg, in water and is being given to the person, and then uh, after 1 hour the blood glucose level is done, and after 2 hours blood glucose level is done. Means at every 1 hour blood glucose level is done till it comes to the initial level. Now, if person is normal, the fasting blood glucose level will be 90 milligram. After 1 hour of the ingestion of the glucose, the blood glucose level will be 120 to the 140 milligram. Now, this is the graph of normal subject who has been undergone GTT. Now, you have to take the blood in the fasting, so that will be 90 milligram. After 1 hour, you have to again tap the blood and you have to go for blood glucose level, that will reach to 120 to 140 milligram. And then after 2 hours, when you go for blood glucose level, again tapping of the blood and going for the blood glucose level, it will come to 2 hours. So the normal person. Now, if the person is diabetic, the graph will be like this. The fasting blood sugar will be 110 to 140. After 1 hour, if you go again for blood sugar level, tapping the blood and going for blood glucose level, it will be around 200 or 220 milligram after 1 hour, right? And after 2 hours, it will not come to normal, but it falls back to the control 6 hours. So normal person takes 2 hours to reach the normal level of blood glucose level, whereas in diabetes it will not come to normal level even after 2 or 3 hours. It takes 4 to 6 hours to reach the control value, that is the random routinely the blood sugar level that the person is maintaining, right? The fifth test is a acetone breath. Now, acetoacetic acid are converted to acetone when its concentration increases greatly. Now, this is most useful when person is in a diabetic coma or ketoacidosis, when excessive acetoacetic acids are formed and they are converted to the acetone, and this acetone is a volatile and it is vaporized in a expired air. So you can even breathe the acetone in the breath of the patient. Keto acids can be detected in urine also. HbA1c, that is we are finding glycosylated hemoglobin, that is we can go for it, and the normal level is 3 to 5%. If it is more than 6%, it suggests that person is having a uncontrolled sugar level since 3 months. So the diabetes is not in a control. Coming to the last part of the diabetes mellitus, that is the treatment of diabetes mellitus. Type 1 diabetes, that is juvenile diabetes. The main reason is for diabetes is a deficiency of insulin. So insulin is the only treatment that will be effective in type 1 diabetes. Insulin are of two types, short acting and long acting. Short acting insulin acts for 3 to 8 hours, that is so usually given with meal, whereas long acting insulin acts for 48 hours. So usually these are given once or twice a day, on this for 3 to 4 times a day according to the meal intake. Type 2 diabetes, the first thing is the diet modification is done, that is carbohydrate ingestion should be least. There should be a person should do exercise, because we have learned that during exercise skeletal muscle does not require the presence of insulin for the glucose uptake. So when we are exercising, the glucose will enter into the skeletal muscles even in absence of insulin. So exercise will help in decreasing blood glucose level in spite of there is no insulin, right? Another, that is the oral drugs sometimes are effective in an initial phase, that is the sulfonylurea and bigonides. Um, these are the drugs that by helps the person by stimulating the cells to increase the glucose uptake. Last one is the insulin, when in the later stage when beta cells gets exhausted in synthesizing insulin and the blood glucose is not in a control by oral drugs, the last thing will be remaining will be to give insulin. So that is this is the end of my lecture. If you have any question, you can ask.